HIV Vaccine Awareness. Over 30 years have passed since HIV was identified as the cause of AIDS. However, researchers continue in their mission to develop a vaccine, while treatments and preventative measures exist to help those impacted by HIV and AIDS. A viable vaccine is still the only means to prevent its spread. The human immunodeficiency virus, HIV, targets the immune system and weakens people's defense against many infections and some types of cancer. As the virus destroys and impairs the function of immune cells, infected individuals gradually become immunodeficient. Immune function is typically measured by CD4 cell count. The symptoms of HIV vary depending on the stage of infection. Though people living with HIV tend to be most infectious in the first few months after being infected, many are unaware of their status until the later stages. In the first few weeks after initial infection, people may experience no symptoms or an influenza-like illness including fever, headache, rash, or sore throat. HIV can be transmitted via the exchange of a variety of body fluids from infected people, such as blood, breast milk, semen, and vaginal secretions. HIV can also be transmitted from a mother to her child during pregnancy and delivery. Individuals cannot become infected through ordinary day-to-day contact, such as kissing, hugging, shaking hands, sharing personal objects, food, or water. Behaviors and conditions that put individuals at greater risk of contracting HIV include having unprotected anal or vaginal sex, having another sexually transmitted infection, STI, such as syphilis, herpes, chlamydia, gonorrhea, and bacterial vaginosis, sharing contaminated needles, syringes, and other injecting equipment and drug solutions while injecting drugs, receiving unsafe injections, blood transfusions, and tissue transplantation, and medical procedures that involve unsterile cutting or piercing, experiencing accidental needle stick injuries, including among health workers. HIV can be diagnosed through rapid diagnostic tests that provide same-day results. This greatly facilitates early diagnosis and linkage with treatment and care. People can also use HIV self-tests to test themselves. However, no single test can provide a full HIV diagnosis. Confirmatory testing is required, conducted by a qualified and trained health or community worker at a community center or clinic. All HIV testing services must follow the WHO recommended principles known as the 5 C's: informed consent, confidentiality, counseling, correct test results, connection, linkage to care, treatment, and other services. Myth: HIV vaccine can give people HIV. Fact: this statement is false. A person cannot get HIV from HIV vaccines because these study vaccines do not contain real HIV. Some vaccines, like those for typhoid or polio, may contain a weak form of the virus they are protecting against, but this is not the case for HIV vaccines. Myth: an HIV vaccine already exists. Fact: this is also false. There is no licensed vaccine against HIV or AIDS, but scientists are getting closer than ever before developing an effective vaccine against HIV. Myth: joining an HIV vaccine study is like being a guinea pig. Fact: unlike guinea pigs, people can say yes or no about joining a study. All study volunteers must go through a process called informed consent that ensures they understand all of the risks and benefits of being in a study, and those volunteers are reminded that they may leave a study at any time without losing any of their rights or benefits. Myth: Western scientists are unfairly using people in developing countries to test HIV vaccines. Fact: in order to find a vaccine that works in all kinds of people, it is necessary to test them in all kinds of people. This is especially true for groups of people that have been hardest hit by the HIV epidemic and who might benefit the most from a vaccine, such as those who live in sub-Saharan Africa. Myth: a person must be HIV positive to be in an HIV vaccine study. Fact: this is false. The vaccines being tested are preventative vaccines. They must be tested on volunteers who are not infected with HIV. There are research groups that are conducting studies of therapeutic vaccines that might be used in people who are already infected with HIV. Myth: vaccine researchers want study participants to practice unsafe behaviors so they can see whether the vaccine really works. Fact: this is absolutely false. The safety of study participants is the top priority of HIV vaccine researchers and staff. Trained counselors work with study participants to help them develop an individual plan on how to reduce their risk for HIV infection. Myth: since pills can prevent HIV infection, an HIV vaccine is no longer necessary. Fact: HIV-negative people who are at risk to take antiretroviral medication daily to lower their chances of becoming infected if they are exposed to the virus. Fact: the search for an HIV vaccine has been going on for a long time, and it just isn't possible to find one that works. Fact: the science of HIV vaccine development is challenging, but scientific understanding continues to improve all the time. It took over 40 years to develop a polio vaccine. Myth: an HIV vaccine is unnecessary because AIDS is easily treated and controlled just like diabetes. Fact: while treatment for HIV infection and AIDS has dramatically improved over the last 30 years, it is no substitute for prevention. Myth: vaccines cause autism and just aren't safe. Fact: many studies have found this claim to be false. The British doctor who originally published the findings about vaccine and autism has since been found to have falsified his data and was stripped of his license to practice medicine. There is no link between childhood vaccination and autism.